Yes, hello, ma'am.
Hello, good evening.
Good evening, good evening. With your permission, I would like to start.
Yes,
Yes,
definitely.
good evening, everyone. A very warm welcome to all our viewers. To tell about myself, I am Niharika Sapra, serving as Gender Champion SHMC IPU and appointed as Campus Ambassador BGen Pharmaceuticals. I welcome you all. Our topic for today's live discussion is homeopathy and mental health. To enlighten on this topic, we have with us Dr. Shikha Singhal. Ma'am is founder and admin of Phoenix Homeopathy, practicing since 14 years in Delhi. Since day one, she has been using single remedy prescription, getting great results in all type of cases. Phoenix Homeopathy has been started with this same vision of following the homeopathic ethics of single remedy with minute dosage. It aims to dive deep into the mind of the patients and heal them. Now, this group is of more than 400 doctors, and this makes ma'am best fit to talk about this topic because her method of prescription is all about mind. To mention, ma'am has many associations with NDMC and frequently conducts seminars and webinars for the same purpose. Welcome, ma'am. We are glad to have you with us. Over to you, ma'am.
Thank you so much, Niharika. And I must say, BGen Pharmaceutical Initiative is really helpful for all the doctors and going through all the lives you people are having. And I would say thanks for inviting me today also. And we can start the session.
Yes, ma'am, surely. Ma'am, whatever introduction you would like to give regarding the topic.
Yeah. So, mental health is our favorite topic, but I would not say it's all about mental health. Whenever homeopathy comes, mental health comes simultaneously. So, to have a healthy life, we need a very healthy mind state. And this is very sad that nowadays no one is having a very healthy mental state. Even a 5-year-old child is also stressed. Even a 55-year-old person is stressed, and 80-year-old person is also stressed. So since 14 years, I'm going through so many cases. I've gone through so many cases, and where we can find a direct correlation between mind and homeopathy, and we are prescribing remedies on the basis of their mental pictures only. We give importance to the stress, the issues in the life of the patient, and we get very good results, and we'll be continuing doing that only. And in Phoenix also, we are we are not teaching, I would say, but we are trying to make the upcoming doctors, the students, and the doctors aware about how our stalwarts have worked so hard on the mind section of our repertory, so that we can help the patient not with the physical ailments but with the mental state also. So when the patient is in a healthy state, we are also in a very good state.
True, ma'am, true. Ma'am, if you could throw some light on how experiences during our childhood, adolescence, environment at work, school, even at in-laws or at your home affects mental health, and how important are these events while homeopathic case taking, and how homeopathy can help in dealing with them. So basically, three parts to it. Yes, ma'am.
So, if first of all, I would like to start with childhood, adolescence, and marriage. These three periods of life of a person are the periods of transition. The life changes when these three things happen. Childhood is all about memories, is all about innocence, is all about life. I would say the most lively period in a person's life is the childhood. And marriage, if we say, it's a complete transition, it's just like going to another world. And adolescence is also a very different experience for the kids. So, but these experiences are different from both the genders. For males and females, both the transition are completely different, and the bodily changes in the hormones during adolescence is very different for males and very different for females. And childhood I would say is what more or less it is very common for both the kids, right? Both the genders. So if we say marriage is very different for female and it is different for male, because with marriage, for female it comes with new surroundings, new people, new experiences, and everyone is having a different kind of routine. Everyone is having different kind of nature. So a female has to deal with it, and a male has to deal with how his partner has will get acceptance in his own environment. So it's a different thing. And when there is some kind of issue, there is some kind of conflict in these transitions, then the ailment starts. And then our work also starts. Like, for example, if we talk about childhood, so mostly in childhood cases, we see so many cases of bullying. We see so many cases of not getting accepted in their peer age groups. And nowadays, I can see so many kids are complaining that they are not being accepted in their group because of their complexion, because of their height, because of their looks. Even marks also matters a lot. So all these things, and very important point here is the parental pressure. Nowadays parents have become so ambitious that they are putting their expectations on the kids, and this is really harming their mental state, the state of the kids. And we can see so almost 80% of the kids are having specs now. They are dealing with myopias. There are so many neurological disorders like ADHD, autism, specific learning disorders, and we can see so many cases of anxiety and depression in teenage also. And these are just few example I'm telling you. So if I want to talk about from the perspective of homeopathy, then I would like to give example. Like, I had a case of a child who was about to give his JE exams, and just a day before his exam, he had severe throat ache and fever. And when I asked what is the issue, he said, "What if I'm not able to go through?" I said, "What then?" But he said, "My father will really scold me. I'm very tense because he's not going to leave me. And I don't know how he's going to react. And that failure point is the only thing I'm actually tense. I'm not tensed about my preparation. I'm tensed about what if I'm not able to go through." So such kind of cases we are dealing with, and I gave him that carcinosin, and he was completely fine before just within 4 to 5 hours of giving the remedy. And then if we talk about marriage, so marriage, I had a case of a female where she said, "I never felt that I am accepted in my in-laws." She said, yes. She said, "My mother-in-law is very strict. My husband is a mama's boy." And this is a very common say of females. So I said, "What do you do then?" She said, Every weekend I'm going to my mother's place just to get a break." And I said, "You think you'll be able to deal with this in like this?" So she said, "I don't have any other option, but I feel homesick. I want to go to my mother's place, and I'm every time I'm talking about this issue, I'm just crying, and daily I'm complaining to my husband, and he's not taking any kind of steps." So I gave her pulsatilla, and this helped her a lot. So in this way, homeopathy can help you help the patient with their conflicts also. And we have seen great results. And then if I talk about the professional life, and that is very important. Recently, I came to know about BHMS, that program, budding program. So they are helping with helping the students to cope up with the pressure of starting their professional life, because homeopathic students are first and second year is very relaxed and very fun type, and from third year, fourth year onwards, they have that pressure. Now what we are going to do? They are so much of pressure from our parents' side. We have to be successful. So this is the pressure. This is the work pressure people have just before starting. And I had a case of a boy where he started doing a job, and he said, "My issue is that I cannot face people. I want to escape from the meetings. I cannot talk in the public. Although if I'll start talking after a certain period, I'll be very comfortable. But I'm very timid while talking to new people, and I just feel that they are looking at me only. So I start stammering. I gave him lycopodium on the basis of his timidity. So in professional life also there is that performance pressure, there is the pressure to excel everywhere. So this pressure is the thing that is just harming each and every person, may it be marriage, may it be childhood, may it be work area, whatever it is. So we have to go through their conflicts. What are they thinking? What are the issues they are dealing with? We are not looking at the physical complaint. Now, if this lycopodium patient had cancer, I would give him lycopodium only because this is a conflict. If he is having prostate issue, I'll give him the same remedy because his conflict is this only. So this is how we help the patients to heal, and this is how the mind section of the repertory, the mental picture of the patient help us.
Yes, ma'am. Very true. And different phases you have explained so beautifully with cases. And ma'am, talking about the mind method, when there is an acute case, so how to guide students, how should students or homeopathic practitioners proceed with acute cases?
Yes, yes. So we are really blessed that our stalwarts have done a great work when it comes to mind section, and we have many rubrics that help us in our acute prescription. First of all, in our acute prescription, we always see the current state of mind of the patient that we call as PPP, present, persistent, and peculiar thing. And there are rubrics like dullness, irritability, and mood repulsive, even rest desire, carrot desire. There are so many rubrics. And if I have to cite an example, recently, just 2 days ago, at around 10:40 p.m., I got a call from a patient, and he said, "Doctor, I got a loose stool, and I cannot afford to be on the bed because I have a very important meeting tomorrow." I said, "It's just a stool, just one stool. It is okay." But he said, "No, doctor, as a precautionary, I want to take the medicine because I have a very important." The moment I started asking him, "How are you feeling? What happened?" He said, "Doctor, please, if you can give me the medicine, tell me. Otherwise, I'll take some antibiotics, but I have to go to the meeting tomorrow." I gave him Naxomic on the basis of mood repulsive and anxiety business about. And morning only, I got a message that after that I slept peacefully and I'm going to my meeting. So, like this, in acute prescription, we have beautiful results. And I don't know why people say that homeopathy takes a lot of time and it is not helping in severe drastic situations. No, homeopathy helps miraculously. May it be diarrhea, may it be heat stroke, may it be anything. So we have results in cancer also, and we have very good results in fever also.
Yes, ma'am. True, ma'am. And ma'am, when we talk about infants, so while case taking of infants, how can we proceed?
So in case infant cases are very tricky. They are not very easy to deal with. So when it comes to infants, infants means kids less than 6 months. So 99% percent of the time we have to take mother's pregnancy history. What was the state of the mother during her pregnancy? And mostly we get a very big conflict. Like pregnancy is a period where each and every mom to be wants special care, special attention from her family, especially from the husband. So if there is a history of being neglected, there is a history of some loss, if there is a history of job loss, money loss, or I had a case where the lady used to get abused. Her husband used to beat her a lot. He used to he was in that state that I want a male child only, and if you will not deliver a male child, I'm going to leave you. So that stress on the lady was so much that she used to think that if she used to wish to to God that I should deliver a male child only, otherwise my husband will leave me. So on this basis, fear invalidity, I gave her child Ignatia, and the child was at that time child was premature, and prematurely delivered, and I gave him Ignatia for his breathing issues. and it helped him so much. Within 48 hours, the child was out of the incubator, and still he is doing good. I know the child. And in the same way, I had a case of neonatal jaundice where the child was advised to get hospitalized for phototherapy. So when I asked about the pregnancy conflict, there was no conflict, no conflict at all. But then I asked what happened during the labor. So her husband told me that the labor was prolonged, and she was so angry during the during the labor. Even if we were trying to console her, she was not letting us talk. She was extremely angry during her labor. I gave the child HIPAA self, and within around 36 hours, we got the test repeated, and the bilirubin level of the girl was drastically improved. This is how we take the case of infant. We need to have different approaches when it comes to a female who is newly married, a teenage. Our way of case taking will be different. We have to be more gentle while taking the case of a teenage. We have to be more gentle while taking the case of an infant, because there we'll hit the trigger points of the mother. So we have so many females who are dealing with postpartum depression nowadays. So this is how we go in this direction.
I would like you to spread some awareness about how the mother's state during pregnancy can affect the child
Yes.
after his or her birth. Please, some words on it.
Uh, the way mother wants special care during pregnancy, this is the same way a child wants special care during pregnancy. If the mother is not in a healthy mental state, if the mother is not enjoying her 9 months period, then this is going to affect. For example, a mother who conceived without planning. It was a accidental pregnancy, and mother is not ready for the pregnancy. During the initial phases of pregnancy, only the child will feel rejected, that my mother is not will not keep that bond with me, she'll not accept me. Or if the mother is very concerned about her work professional life, that because of this child my professional life will suffer, this will also affect, because the bond between the mother and child is very important during pregnancy. And if the child is not getting that affection from the mother only, if the mother is too busy to deal with other conflicts, like she is getting neglected, she is not getting pampered, she is not getting extra care from her husband or mother-in-law, then she'll definitely neglect the child. So this affects the child in many ways. And nowadays there are so many cases of congenital disorders, and these are the reason when there is a conflict. Not only the mother, but in many cases father is also having some kind of conflict. So
Yes.
because of these things, the child gets neglected, the child also suffer, because if there is life in your home, so the life has emotions. Till the time a person is breathing, the person is able to survive, the person is having emotions. May it be a patient of coma, may it be a patient, may it be a 2 days old child. So if we are not giving that proper affection or proper attention to that person, the person is going to suffer at any cost.
Yes, ma'am. Wonderful words, ma'am. And ma'am, when we talk about terminal illnesses where we don't have any cure, we can only palliate,
Hmm.
and the condition of the patient is so bad mentally because the patient knows that I am about to die, or things like this are happening in their life. So how do we approach those patients?
So in case of terminally ill patient, mostly we ask our first question: what is the concern regarding this disease? For example, if a person is having cancer, we'll ask, what is your concern? Are you stressed regarding? So that is the entry point. Many a times, mostly patients says, yes, we are concerned about our family. I'm concerned about my kids, and many patients say we are concerned about the expenses for the treatment. So here only we have so many rubrics. When they are concerned about the expenses of the treatment, there is anxiety money matters. When they are concerned, they have concern about their kids, anxiety children about their family, anxiety money matters about. And I'm not able to do anything for my family. I'm feeling really unproductive. This is anxiety bending on anxiety sitting bend. So we have so many points where we can start the case. And not this is not common that the patient is ready for his end, but many a times the patient is in a content state. Okay, let it be. What will happen, I will see. Okay, I'm ready for death also. So this is a state of content. This is a morbid content. It should not happen. The patient should feel bad about his state. If the patient is in content, then also we will consider it. And we have a remedy where the patient is very happy that yes, now I'm going to die and I'm ready to die. There we give aurum metallicum to the such patients. So, in case of terminally ill patient, also we see their current state of mind, and if we don't get their current state of mind, then we will ask the family, the attendants, that what happened before when all these things were happening, what happened before this particular issue was there. So we get beautiful entry points, and we can use them in our case, and we it helps us to cure the patient. Even if the patient is not cured 100%, but it will help the person to live a peaceful life, maybe 5 years, 7 years, 10 years, but the life will be peaceful.
Yes, ma'am. And this way, the disease is also treated, and the mental condition is also treated alongside, as homeopathy is acting holistically. So, ma'am, talking about lifestyle, how does our lifestyle, eating habits, sleep cycle, daily routine affect our mental health? To talk about, if you could make our viewers aware about it.
Definitely. Nowadays, it's very common that both the parents are working, both the parents are really busy in their career. So many a times kids get neglected, and we can see kids are getting absorbed in mobile phones, they are getting absorbed in laptops, games, gadgets. So that neglected atmosphere is leading to the screen time, and the screen time is leading to so many neurological disorder, and the most common is autism. Screen time is a very big reason for autism, for ADHD. And next, I will talk about the sedentary lifestyle. The sedentary lifestyle is causing so many issues like insomnia, obesity, and then cardiac issues and diabetes. So many lifestyle issues are there that are directly leading to the altered state. So, in such cases, we give remedies, but definitely the patient has to take care of their routine, of their lifestyle. They have to change their habits. Then only medicine can help, because 60%, 50% medicine and 50% is their own hard work behind their cure. Their health should be there.
Yes, ma'am. Totally. And ma'am, if you could advise our viewers some mindful activities, techniques, or any exercises which could help them if they are suffering from any mental health issues.
So, exercises, so I won't be able to tell, but yes, I would definitely say don't use mobile phones or laptops while having meals. Try to have meal with your family. Spend good quality time with your family, and don't try to introduce mobile phones to your kids also, because just to escape, many parents give phones to their kids, and in future, in after 2 years, they only repent that we gave mobile phone to our kids, and now they are completely indulgent into it. And even I would say, mm, don't don't make your child exposed to television also, because I can see kids are watching porn nowadays. They are trying to be like adults. They are trying to copy their family members, and they want to become like that, and at a very early age only. So I feel that these things should be reduced, and people should give more family time. They should have very healthy lifestyle. They should not indulge in, because sugar content is a very important factor nowadays. Sugar content not only in kids but in adults also. This is causing a lot and lot of hyperactivity. Even adults are suffering from hyperactivity nowadays. So we should reduce on our sugar content in terms of these aerated drinks, these juices and all. So these things will help everyone.
Yes, ma'am. And ma'am, talking about our young generation, Like we also see we have good remedies when it comes to dealing with exam stress or dealing with breakups or dealing with other life situations. Regarding that, if you could say a few words.
So, if I talk about examination stress, so we have a lot of remedies like lycopodium, gelsemium. These remedies help the patient so much because they have very typical thing is there. I'll forget, I'll get fail, okay, and I won't be able to do it. Doctor, I get blank when I look at the examination sheet. This is a very common say. So always and always we'll find there is some kind of stress, there is some kind of concern is there in the patient, in the child. They want to either they are very ambitious, they are putting pressure on themselves only, or the parents are putting a lot of pressure that you should get more than 90%, you should perform very good, or there one more factor is there, the child is feeling very responsible towards the family. The child wants to take a lot of responsibility is of the family, and they want to succeed to help their family, and this is also a kind of pressure where they start doing different kind of jobs at a very early age, where they just stretch themselves to get good marks. This is again causing depression and anxiety in teenage and even in early 20s nowadays. So we get patients who say we have palpitation issues, we get trembling issues, we have hot flushes, and I get hypoglycemia. So many patients are there who are complaining of all these things before exams. So there is a typical term examination funk that we say. Yeah. So these remedies, we have a direct rubric: anticipatory anxiety, anxiety in examination before, fear of failure in examination. So it's not a rocket science to deal with mental picture of the patient. We just need to know what we have to do, and we should be thorough with the rubrics on the mind section, and then we can easily take the child out of that situation. And if we talk about your love disappointment, yeah, the breakup. Love disappointment is again very common nowadays, but we have to see how the person is dealing with it. If we see a person is disappointed in love, he has recently broken up, then sometimes he becomes revengeful. And this is very common. Acid attacks, murders nowadays, these are so common. Those are the people who become revengeful after there is a breakup. So we give high hopes to them. It is very simple: malicious after disappointed love. We have a direct rubric. So in such cases, yes, counseling is also helpful, but remedy gives a major impact, puts a major impact on the patient. And we get so many patients, even parents are bringing their kids that my child is talking nonsense after he or she got a breakup. So I am very happy that people are getting aware that yes, homeopathy can help them in such cases, such situations also. And even yesterday only, I got a case where there was no physical issue, but the child was not able to decide what he has to do in his career. So for such issues also, people are contacting us, they are coming to us so that we can give them remedy, and the child is having the child can get the clarity where he or she can decide what they have to do in future.
So, ma'am, in this case, what was your approach?
Sorry.
In this
Yeah,
case, when the
in
child.
such kind of cases, we I just ask, ki, what is the thing that is causing hindrance? What is the conflict in your mind? Where is the issue? Why are you not able to decide what do you want to do? Then the child said that I have a history of failure in one exam,
Okay.
and now I think whatever I'll do, I'll fail. I won't be able to do it. Then in that case, we have a very simple remedy: argentum nitricum. So I gave him argentum nitricum. He says, I'm not fit for any kind of job. I feel I'm not fit. Although I'm a graduate, but I'm not, I don't think so. I go through so many interviews, I go through so many openings, but when the time comes that I have to join it, I feel I won't be able to do it. So I just refuse it. So in this case, I gave him argentum nitricum.
Ma'am, this is very common nowadays.
Yes, yes, yes.
We all face this conflict between our minds. So, ma'am,
Yes.
any of your experience, if ever you were in a situation where there were mental turbulences and how you dealt with yours?
If I give my example, so many doctors, even many students will correlate with it, the COVID period. COVID period was a period when we had two concerns, the patient and the family. We had to go to the clinics also, and we have to think about the safety of our family members also. And we had online classes also, being a mother. So there was a kind of turmoil where we were just juggling between these two things, and the atmosphere was very tense. Every time we used to have a patient, we ourselves used to be concerned, oh god, what if the patient is having COVID? So that was a period when we were just praying to god that it should be over as soon as it can.
Yes, ma'am. So, how you dealt with it and how you make yourself positive during that time?
So during that moment, that was a period when there was no time for patient. Even at 2 a.m. at night, we used to get a call that yes, we are COVID positive and we are in a lot of stress. We fast the medicine at 2:30 a.m., 4 a.m. in the morning. We used to we fast the medicines, but the moment we used to get that result that yes, I'm not having fever now, I'm COVID negative now, I'm feeling fresh, I'm okay, HRCT count is better now, all these things that used to give us so much of relief and so much of satisfaction that yes, during this condition, even from our own home, we are able to help so many people.
Yes.
And the people can rely upon us that yes, we'll be able to take them out of this situation. So that was the only mind booster for us during those days, and that helped us to believe in homeopathy more and more, because during those were the time where people were trying anything and everything, but results of homeopathic medicines were so much famous, so famous worldwide. So that created a kind of confidence in us also.
Yes, ma'am. True, ma'am. Anything else you want to add related to this topic?
Related to this topic, I would say when we deal with mind, uh, so that approach of ours change us as a person also, because then we can understand each and every person standing in front of us, even our family members, even our colleagues and friends. So this method brings changes in us also, and this method brings satisfaction also. The chances of relapses are very less. We create a bond with our patient, and the patient has, even if we don't give the remedy, just during the case taking, this brings so much of relief in the patient because they have a vent out. They are there is someone who can listen to their issues, there is someone who can understand their feelings. We are not judging them whether they are right or wrong. Okay? We are not going to take any action against them, so they have a vent out in front of us, and that gives so much of relief to the patient there only in our clinic chambers only. So this is a very magical, I would not say magical, but this is very kind of meditating kind of method. And I would suggest everyone to at least once or twice try this method, try to learn this method, try a few rubrics in your clinic. And when you see the result, you'll be amazed.
Yes, ma'am. And ma'am, you teach this mind method, and Phoenix is all talking about it regularly. Seminars and webinars are there. Recently, also we have one, right? If you would like to share about that.
Yes, we are going to have a 2 days mega seminar on 10th and 11th of May. And the speakers will be me, myself, Dr. Himanshu Bhola, my co-admin, and my admin moderator, Dr. Shailendra Rawat will be there. And we are going to discuss around 10 to 15 remedies in that seminar, all treated with mind method only. And there will be meals, and those 2 days, people who have in past attended our seminars, they know how satisfying and intense those 2 days are, and those 2 days are going to change their lives, because recently when we had our the we have tagged that seminar as Udan, because that these seminars definitely gave wings to so many homeopaths. So when we had Udan 1, so that changed the mindset of so many homeopaths, so many students, that they got a direction that yes, in future we have to deal with this only, and they are reading this method only. And we are very happy that we are getting very good number of enrollments for the same. And I welcome everyone who is watching this discussion today. Come and join us. You'll find so many good insights about homeopathy.
Yes, ma'am. It's great that you are giving young homeopaths a way that they can follow. And as you mentioned, we at BJN also try to give ways and different directions to homeopaths by providing them with our buddy program.
Yes.
So in
Yes.
this, we not only provide them with the basics that they need to set a clinic or their own setup, but also small things like a BP apparatus, a weighing machine is even provided to them. So everything from zero till the end is looked up to for them. So thank you so much, ma'am. And I would like to thank our BJN Pharmaceuticals platform for having you and giving us this opportunity to all the students and other homeopathic practitioners, followers to interact with you. Thank you
Thank
so
you so much. Thank you.
much. Thank you.